my name is Stacey Bailey, and in this week in HCM 490, the Healthcare Management Internship course, we are discussing the future of careers in healthcare management. So the journal article that I chose that correlates with this topic was titled Healthcare Management and the Millions of Jobs That Are Currently in Healthcare and the Millions of Jobs in Healthcare That Are to Come. So to summarize this journal article in kind of a broad scope would be to say that healthcare is dramatically growing due to the demand. There are several diseases inside of the United States that are currently on the rise and causing patients to kind of result in an influx in healthcare needs such as cancer, obesity, heart failure, etc. So, just to give a statistic from the article, it said from the years 2012 to 2022, there would be an increase of 4 million jobs. Something that I took away from this that I thought was very interesting from my internship today, actually, was after observing the patient access manager, we were kind of discussing her role in the facility and patient registration, etc. And she was telling me how before her position here, she was helping in coding, and how now that is kind of a position that is almost outsourced because of the upgrading of EMRs. You don't really need coding. It's kind of a manual thing now, compared to something that doesn't have to be done by hand, which is really neat to kind of see a job completely outsourced by technology. Which wasn't really good for those people who were employed by that position, obviously, but it frees up some money for the healthcare industry to allocate funds to better the facility in other areas. So, actually, another individual that I observed today was the FBC nursing director, and she has been a nurse for 41 years, and her exact words to me were, whenever she first started, healthcare really seemed to be focused around care, and how now it was really and truly focused around costs. Not to misunderstand her, that healthcare was still about prioritizing what's best for the patient, but now the prioritizing what is best for the patient is absolutely done so with costs in mind, which I have absolutely seen myself from throughout my internship. But the future of careers of healthcare management majors are definitely without a doubt on a rise. Healthcare is, like I said in the beginning, is growing and in very high demand. There is an absolute major nursing shortage throughout the United States right now. We will always need laboratory personnel, radiology personnel, surgery personnel, etc. But as technology advances, as I also previously mentioned, we are outsourcing some jobs, so we're also bringing in some extra jobs. In the last few years, the facility that I'm working at has been adopted by the UNC healthcare system. So in the last few years, we have been able to take money that have been saved from other aspects as we are improving the facility to create new jobs. For example, in the last few years, we have recently created a position for a bariatric coordinator, a clinical outcome specialist, and a quality and patient safety analyst. So we are definitely taking the money that we're saving from wasting and taking it and putting towards a good cause for bettering the facility in regards to efficiency, productivity, and absolutely cost. So the future of careers in healthcare management is without a doubt there and growing, and we are able to reallocate those funds we're saving by saving on efficiency and productivity to continue to set aside more individuals who can increase the facility's operating capabilities. So for those in healthcare management, this is a growing industry, and I believe that there's job security in that. Thank you.